Today, we're talking about something really important, the incredible team of specialists who come together to care for someone diagnosed with breast cancer. If you or a loved one is going through this, it can be overwhelming. But knowing who's involved and what they do can make a big difference. From diagnosis to treatment and beyond, many experts work together to make sure each patient gets the best care possible. So let's break it down. First up, let's talk about how the process usually begins, and that is with the diagnosis. So this is where radiology and pathology come in. The radiology team plays a critical role. Radiologists are the doctors or the specialists who interpret imaging like mammograms, ultrasound scans, and even MRIs. They look for abnormalities in the breast and help pinpoint any areas of concern. If a suspicious area is found, the next step is usually a biopsy, where a small sample of tissue is taken. This is where pathologists come in. Once the biopsy is done, the pathologist examines the tissue under a microscope to determine if cancer is present, what type it is, and how active it might be. They are essentially the detectives behind the scenes, providing essential information that helps guide treatment decisions. Once a diagnosis is confirmed, the patient is supported by a multi-disciplinary team. This means many specialists come together to discuss the best treatment plan for that patient. And this is where we meet the other key players, the breast surgeons, oncologists, and breast care nurses. Let's start with the breast surgeon. As a breast surgeon myself, I'm often involved early in the process. My role is to assess whether surgery is needed, and if so, what type of surgery is best. This could either be a lumpectomy or breast conservation surgery, where only the tumour is removed, or a mastectomy, where the entire breast is removed. Surgeons also assessed whether lymph nodes need to be sampled to see if the cancer has spread anywhere else, especially in the armpit. Next, we have oncologists. Now, there are two main types involved in breast cancer care: medical oncologists and radiation oncologists. Medical oncologists are responsible for deciding whether chemotherapy, hormone therapy, or targeted therapies are needed. They will look at the specific type and stage of cancer to create a treatment plan designed to stop the cancer from growing and prevent it from returning. Then we have radiation oncologists, who are experts in delivering radiation therapy to destroy any remaining cancer cells after surgery. Radiation is often used after a lumpectomy or even after a mastectomy. It does really depend on the case. Now let's talk about the role of the breast care nurse. These nurses are a cornerstone of the support system for patients. The breast care nurses provide information, emotional support, as well as practical advice throughout the entire process, from the moment of diagnosis through treatment and recovery. Breast care nurses help patients understand their diagnosis, explain the treatment options, and provide guidance on managing side effects. They also answer any other questions patients may have. They also connect patients with support groups and additional resources, ensuring that no one has to go through a diagnosis alone. They are there for every step of the journey. Now, there are other important specialists, which may include plastic surgeons if you have a reconstruction, as well as genetic counselors if you are considered to be a high-risk patient needing more genetic testing. And this can also influence treatment decisions for their family. So breast cancer care is truly a team effort, and each specialist plays a critical role in making sure the patient gets the best care possible. I hope this has been helpful, and I'll see you in the next one.